So now what I'd like to cover is the temporomandibular joint. And in our society, there is quite a bit of temporomandibular joint issues that present themselves um, both to soft tissue manipulators like myself as a rolfer and also craniosacrally. So what we want to really cover is uh, a thorough, as much as we can, a thorough understanding of the TMJ and how it's impacted. We want to get a real sense of how we can explore this area, and we want to start looking at how the motion of the mandible is perceived. So, the important thing to think about as you're holding is that the mandible is going to essentially move in synchronicity with the temporal bones. It's a reflection of what's happening. So whatever's happening in the mandible, you'll feel it in some kind of relationship to the temporal bones. Any kind of release of tension, as we spoke about prior to this, to the temporalis, the masseters, um, any kind of release in the soft tissue, cervical muscles, anything that's connecting around the anterior part of the neck, the hyoid bone, um, atlas issues, AO issues. All this can create some patterns within the reciprocal tension membrane itself, or specifically to the TMJ itself. And so it's important that we kind of stay global.
TMJ is a real issue for a number of people today in our society, and it can have a number of implications. And so, having the ability to help people with this particular issue is huge for us as craniosacral therapists. I do believe we're probably as good as anybody at dealing with this issue. So I want you to be good at it, and that's why we've devoted this entire DVD to this.